am not a huge fan of Advantage plans, and for good reasons. However, there are times when the Advantage plan is really the right and wisest choice. Now, let's be honest. Most agents would tell you that an Advantage plan is always the right choice. Why is that? Because they always make more money. A higher commission is paid on Advantage plans. So I'm not saying that. What I'm saying is that the Advantage plan sometimes is the right choice. So in this video, I'm going to share with you 5 reasons why I would choose an Advantage plan. All right, so the first reason would be if my monthly budget is extremely tight. Okay, let me explain what I mean by that. Let's suppose that someone enrolls in A and B and they get a supplemental plan. All right, so what happens? Well, A for most people is 0 premium because they have 40 quarters, 10 years worth of work paid into Medicare taxes, right? So A is normally going to be a 0 premium, but B cost. Most people this year, and I'm shooting this video, it's March the 21st of 2024, so this year's Part B premium, and again, we're talking about B on this, is $174.70 on a monthly basis. Now, if someone's on Social Security, this Part B premium comes out of their check. If they're not, they can be billed quarterly, or they can set up some kind of an auto draft with the government. But the point is we're paying for Part B. Now, if someone is eligible for Medicaid, which means low income, low assets, limited resources, then they may get that paid by their state. Okay, but the point is the majority of people, they're paying for their $174.70. And I do want to mention this. This is also based upon income. So if someone's a single filer and they make above $103,000 a year, then they pay an additional amount for Part B as well as Part D. If you're a couple, you pay you make $206,000 modified adjusted gross income, 206 and above, then again, there's an additional amount added to that. That's about 15% of the population that pays more. So we're paying for Part B. If I get a supplemental plan, now the majority of people right now, about 70% are getting a G plan. That G plan on average is about $125 a month. Now you may live somewhere where it's a little more, a little less, but I'm saying that's about the average now across the country for someone that's 65. If they have an N plan, the second most popular plan, about 70% of all people, 70% get that, 30% get the N plan. Right now, that's in the neighborhood of about $95 a month. Let's call it $95. Again, your state could be a little lower, it could be more. But the point is we pay a premium for that. In addition, I have to have a drug plan. Now, there are some drug plans this year. These are Part D plans. There are some that are 0 premium. There's some that are 50 cents. And there's some that could be as high. I think the average right now is about $30 a month. But I have to have a premium for that. So what's my point? If I have this scenario here, I'm paying Medicare. I'm paying my premium, whatever plan I go with, plus I have a drug plan. Let's say that drug plan is $25 a month. Again, there's some that are quite less, but still, let's say we're that. So let's just do it simple. 25 for my drug plan, 125 for my G plan. Now I'm at 150 and I got 175. We'll round that up a little bit. So what am I spending? I'm spending about $325 a month in premium. And frankly, there's some people just say, I cannot afford that. I'm struggling just affording that. All right, so that's what I'm saying over here. If I have my Advantage plan, what's going to happen is this. I got to pay my Part B unless Medicaid pays for it. That's $174.70. But what happens is that C plan is usually a 0 premium. They say right now there's about 4,000 Advantage plans throughout the country. 2 out of every 3 of those 4,000 plans have a 0 premium, which means it doesn't cost you any money as a premium to be on that plan. Because instead of paying a premium, what you're going to do is you are going to have to pay co-pays. You're going to have to pay sometimes some co-insurance. So it's not like it's going to be free for you. But again, you're taking on the risk of saying, I'm pretty healthy. I rarely go to the doctor. And so instead of having to be forced to pay a premium here, I would rather be on a plan that's 0 premium. And then I'll just kind of pay as I go. That's that system. So that's my first point to you. If someone's budget is extremely tight and it's going to be a struggle paying for that D plan, paying for that G or N plan, then they ought to be looking at an Advantage plan, because my experience says that they probably wouldn't keep the supplemental plan if they got it. So might as well find that very best Advantage plan that they can for their situation. Now, the second reason would be if the perks that are offered by the Advantage plan are really a priority, and for some people it is. Again, let's go back and talk about our system. If I'm over here on a sub plan, most sub plans have no perks whatsoever. Occasionally, we'll see a plan that may give you a free gym membership or maybe a discount plan for dental, vision, hearing, or something. But again, supplemental plans are really all about about insurance, we just don't have perks. Now, when it comes to the Advantage plans, again, those are called C plans, we're going to have a variety of perks. They almost always are going to have some kind of a gym membership. This would be community centers, maybe YMCA, Curves, different places that will actually allow you to go to their facility, and the Advantage company will actually pay for that monthly gym membership. So that's a nice perk. I had a lady the other day actually that went to a gym, literally it cost $100 a month, and that gym of hers was in network and it covered the expense of that. So again, that's a perk. Could be a priority for somebody. These also have a dental allowance, and that dental allowance ranges anywhere from $1,000 upwards to maybe $3,000. It varies for sure, but as long as your dentist takes the plan, that may be something that would be a very nice benefit for you. That dental allowance, again, you do have to ask, is it a network plan? How does it cover? Is it 50-50? Is it 80-20? But you got to find the details out. But the point is, some people are attracted to that because of that. They also have some kind of a vision allowance. Okay. Now, I will tell you this, just so you're clear, over here on the supplemental side, you have wonderful vision coverage. But what the Advantage plan does is they actually will give you some type of a credit for eyewear, usually about $200, $250 a year, and they'll pay for one preventive eye exam on an annual basis. So again, they kind of beef that up as well. These also have hearing aids. That is not uncommon today. And the way the hearing aid program works is one of two ways. Sometimes they'll just give you a simple credit for hearing aid per ear per year. It may be $1,500 per ear per year, or $500 per ear per year. Or they may put together a network of providers that will actually provide hearing aids, and you may have a copay of $200, $300, $400, $500. I've seen some as high as $1,200. But the point is, a hearing aid would be a part of that Advantage plan as well. And then what we also have is we have a thing called an over-the-counter card, where you can actually get over-the-counter items through a catalog or online, and things you typically get at Walmart or Costco or Hy-Vee, or I'm just thinking of some places, CVS, Walgreens, those kind of places, and you can actually get those over-the-counter items, and they'll mail those to you. So that's a benefit, normally $75 to $100 on a quarterly basis. Sometimes they even have what they call a flex card. This would cover other things. Could be co-pays that you have if you went to see a specialist. But my whole point is that these perks are attached to all Advantage plans. And there are some people that say, hey, I really do need hearing aids, or my gym's part of that. And so they're willing to actually enroll in that plan because they see the advantages of the perks. All right, so that's reason number 2. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up, as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, that brings us then to the third reason why it could be a right choice, and that is if you say, hey, I'm fine, or I'm okay with being in a plan that has networks. And also, I'm fine being in a plan that has pre-authorization. So let's quickly talk about these. So when we talk about a network, what we're typically talking about is either an HMO network or a PPO network. And both of these exist within the Advantage system. Now, the majority of plans are for sure HMOs, but there's also plenty of PPOs in some markets to choose from as well. Here's the difference. If I have an HMO plan, what I am required to do is I must stay in my network. I have to stay in my network and see the providers that are contracted with that plan. The HMO plan has that restriction. You've got to stay in network. Now, the exception would be if you ever have an urgent care situation or an emergency room situation, you actually can go anywhere you want in the world in that situation. But if it's not emergency, not urgent care, then you have to stay within the confines of that network, those hospitals, those doctors, those specialists that actually take the plan. Okay? Now, we also have PPOs within Advantage system. So what they do with this is it's financially more attractive for you to stay within the network, but you also have out-of-network options as well. So you can go to any provider that takes Medicare that will also take your plan. Okay, and so we have that out-of-network option on the PPOs. Also, the difference is sometimes the HMO will require you to see your primary care doctor to see a specialist. In other words, you have to have that referral, and so that's a requirement on some HMOs. PPOs never require that. They just say the person has to take the plan or take Medicare, and then you can go out of your network. Now, it costs you more if you go out of network on the PPO, but at least you can do that. All right, now, if I compare this to like original Medicare with a supplemental plan, we never have HMOs or PPOs. But if you say, hey, it doesn't bother me to be enrolled in an HMO or PPO plan. Now, I want to just add this as well. HMO plans, what you'll find is that they tend to be a little bit more attractive with the perks and also with the out-of-pockets. Your HMO plans typically have lower copays and lower max out-of-pocket. Why? Because that insurance company really has a little bit more control over that network, and so they can actually pass on that savings to you. But again, you have to be real comfortable with the fact that if you're on the HMO, you cannot go out of your network. You've got to stay within those providers. All right, and we'll talk to you just a little bit about pre-authorization, but let me explain it first. Pre-authorization is a situation where someone needs something that a healthcare service that was not cheap. In other words, it's kind of expensive. It could be an MRI or maybe a CAT scan or even a PET scan. It could be an extended stay in a skilled nursing facility. Someone's had a hip replacement or maybe an accident or injury, and they go to skilled nursing. Certainly to have that extended stay is going to have to be pre-approved. Someone could need a knee replacement or a hip replacement. That's certainly going to require pre-authorization. So pre-authorization means that the doctor has made a recommendation, but because a pre-authorization is attached to that healthcare service, again, really anything that's expensive, they say about 70% of the time, healthcare services on Advantage plans are going to require that pre-authorization. So doctor makes a recommendation, but has to have the approval of the insurance company. And so certain paperwork is, sent out electronically to the insurance company, and they're going to review that recommendation. And sometimes, frankly, they approve it immediately, but other times they don't. They actually delay it, and they may say, no, we want a second opinion, or we want you to try therapy first before we pay for that hip replacement or knee replacement. And sometimes they just flat deny it. They say, we don't agree with the doctor, and you're just simply not going to get that service. And so when we have a pre-authorization, that's what can happen. It could be approved, it could be delayed for a time, or it actually could be denied. All right, so you have to be fine with that. So let's get back to the board now, just talk about these pre-authorizations. So again, these things are expensive services. So again, what's going to happen? They're going to say, yep, we will let you do that, or we delay it. And what this means is they're going to say, we may approve it, but first we want to see further evaluation. We want more information from the doctor. And sometimes these things are delayed where we've seen it actually impact people's care. They really needed it quickly, but they didn't get it, or sometimes they actually can deny it. But if you say to me, hey, Marvin, I am fine with that process. I've had to do that before. That's acceptable to me. Then it is great then if you choose the Advantage plan. Why? Because you're saying, I understand what I'm getting. I understand I'm getting a network plan. And I understand there's also a possibility that I will have to go through the pre-authorization process depending upon what my health care needs are. All right, that brings us then to reason number 4. And that's this, someone that looks at Advantage as an option. And they say this, hey, I'm fine, I'm okay with the Advantage plan risks. Now, what do I mean by that? There's actually 2 different types of risks that you must accept and agree to when you take an Advantage plan. The first one is this: you have to be comfortable with what we call the annual max out-of-pockets, okay? Annual MOOPs. Now, what I mean by that? Well, remember I taught you earlier, Advantage plans usually have a 0 premium, so what do? Well, we pay copays. We pay co-insurance. Okay, which is normally 20% on certain supplies. But the point is, we pay as we go. And so the risk is you're saying I'm comfortable with paying out of pocket until I hit my max out of pocket. Okay, now this is an annual amount. I would say right now HMOs are going to be in the neighborhood of about $3,000 to $5,000 for the year. I would say your PPOs are going to be somewhere between about $4,000 to $10,000 for the year. So that's the risk you have to be comfortable with. Now, would you hit that max? Maybe not, probably not. But if you enroll the Advantage plan and you have cancer, you have something serious happen, you've got to be comfortable with actually assuming that risk, because that's the most you would ever have to pay. And so we pay copays. For instance, I go to the hospital, it's not going to be free. It's going to cost you about $350 a day, up to maybe 5 or 6 or 7 days. And then every time you're hospital, again, you're hospitalized, you're going to have to pay that daily copay. If you have an outpatient procedure, outpatient surgery, it will not be free. It'll be reasonable. It's going to cost you probably $250 to $300 for maybe cataract surgery per eye or a knee replacement. And so you have a copay. if you have a CAT scan or an MRI or PET scan, they're not going to be free. You're going to pay anywhere from $150 to $300 for that particular test every time you have one of those. So the point is, it's a copay plan. You have chemotherapy, it's going to cost you 20% co-insurance. Durable medical equipment, diabetic supplies, those kinds of things typically have co-insurance about 20%. And all of those copays and co-insurance, again, is going towards that annual max out of pocket. And then once you hit the max, if you ever do, then you put your purse away, your wallet away, your checkbook away, because now the plan will cover everything at 100%. So you have to be willing to be comfortable with that risk. Now, I will tell you this, there are ways to eliminate that risk as well or reduce it drastically by doing what we call a copay protection plan. Those are also something available if you're uncomfortable with that amount. But the point is, that's one of the risks. And the second one is this, is that you run the risk that you could be on that Advantage plan permanently. What do I mean by that? Well, what happens with the Advantage system once you go on one, let's say you start one at 65, and you're on the plan for a year or 3 years, 5 years, whatever, 7 years, and you're on that plan. In order to get off an Advantage plan in all but 4 states, those 4 states that don't have this rule are New York, Connecticut, Maine, and Massachusetts. Those are the only ones. But all the other states, 46 states plus District of Columbia, if you've been on an Advantage plan for a year plus, what's going to happen to get off the plan now, you're going to have to medically qualify to be able to get back in the other system, which is A and B with the supplemental plan. If you want that G plan or that N plan, you're going to have to medically qualify to do that, which means when I help someone switch from Advantage to a supplemental plan, I have to ask them 30 health questions. I'm going to check all the medications they're taking now or have for the last 24 months and probably get a statement from their doctor. And that health information is then given to an insurance company, and you're going to go through what's called the underwriting process. And that health insurance company is going to evaluate everything, and they have the right to say, no, we're not going to insure you. We don't like the fact that you have AFib, or we don't like the fact that you have COPD, or you've had cancer in the last 3 years, or you have spinal stenosis, or you're a diabetic that takes insulin, or all combination of things that could happen health-wise. So my point is, you run the risk of, if you go on the Advantage plan and you stay on that thing for a while, and now you want to get off of it, now it's going to have to be evaluated from a health standpoint whether you can get that supplemental plan or not. Now, when you first go on Medicare, those insurance companies have to take you. The key date on that is called your Medicare B date. We can apply for a supplemental plan 6 months before the B date in most states, and then my A and B start, my supplemental plan all starts on my B date. But after that B date, I still have an additional 6 months. Okay, let me just give you a quick example. Maybe this will make more sense. Let's say that someone had a birthday today. They're 321 and they're born 1959. Okay, I'm shooting the video March 21st. And you're turning 65 this month. You would have started your Medicare A 3/1/2024, and you would have started your B 3/1/2024. Okay, now, if I work 2 more years, my B date may be 3/1/2026, but the key date is the B date. And what I'm trying to teach you is that when you first go on Medicare B, we can actually apply for a MedSup plan 3 to 6 months before. It'll all kick in on my B date, but I still have 6 more months after the B date where I can still get a Medigap policy, that MedSup plan, with no underwriting at all. So those 6 months in this example would be what? March, April, May, June, July, August, which means what? September 1, 2024, now that 6-month window where I had no underwriting, now that's terminated, it's expired, and now for really the rest of my life, except in those 4 states I mentioned, now to get a Medicare supplemental policy, you have to medically qualify. So my point is, when you take an Advantage plan, you run the risk, if you stay there on a long time, and now you want to get off of it, now you're going to have to medically qualify. You don't have that risk when you first start your Medicare B. But that could happen to you if you select an Advantage plan. And you may say, I'm fine with that. I'm fine with networks. I'm fine with pre-authorizations. I'm fine with max out of pocket. I'm fine with the risk of being on that plan for the rest of my life. Then again, that's when the Advantage plan could be the right choice for you. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, that brings us then to the last reason, and this is a major reason. And that is if you're in a situation where you have VA benefits, you served our country, and you've gone through the process of knowing what kind of VA benefits you have, and you like the VA system, you're using the VA system. Okay? Or you have TRICARE. This means you're retired military. Not that you just served in the military and have VA, but you have TRICARE. This means you're retired from the military and you have wonderful insurance called TRICARE, right? And then, or you're retired civil service. You're with the FBI, the IRS, Homeland Security, Treasury Department, whatever. And you have FEHB. That stands for Federal Employee Health Benefits. These three groups of people, very unique situation. Many people that have these today are getting Advantage plans, okay? And what they do is this. The reason we emphasize VA, TRICARE, and FEHB is because you have the option, you of course keep these insurances, but you actually can get your prescription drugs through VA, TRICARE, or FEHB. So what we do with the Advantage, instead of getting in a Medicare Advantage that includes a prescription drug, which all people will do except these here, they have a Part D plan embedded, what you can do is you can do what is called an MA-only plan. Why? Because your prescription drug plan is going to be credible through VA, TRICARE, or FHB. So you can do an MA-only plan. And it's really a very, very attractive package. For you veterans, why would I consider an MA-only plan? Because it gives you a civilian option. The majority of these are going to be zero premium, plus what they do is oftentimes they'll give you what is called a Part B give back. So right now our Part B premium is $174.70. I taught you that earlier, based upon income. We have a lot of these plans that will actually give you $100 credit every month for your Part B. So all of a sudden you just open up a wonderful civilian option for you, and you're paying $74.70 a month for your Part B. It's a wonderful benefit, and now you have options beyond Medicare, beyond VA. But again, you're going to get your scripts through the VA system, which is very attractive anyways. Now if I'm TRICARE, what happens? I, again, can enroll in an MA-only plan, same thing. My Part B premium, which I have to pay anyways, because if I have TRICARE only, you have to have Medicare A and B to be in the first payer position, because TRICARE only pays second to Medicare. So what happens, you can enroll in an MA-only plan, and TRICARE will actually coordinate with that MA-only plan. All you have to do, again, use TRICARE for your medications, but you'll use, for your in and outpatient, you can use that Advantage plan and then take advantage of all those additional perks that the Advantage plan offers that TRICARE does not offer. So again, great reason. Same thing is true with FEHB benefits. You can enroll into an MA-only plan. You can keep your FEHB, or you actually can suspend it if you want to. Now, if you suspend FEHB, which a lot of people do, then I would go ahead and get prescription drugs here. But if you keep FEHB, you can also have the MA-only plan, and FEHB will coordinate with that MA-only plan, get your meds through them, and then you have, again, all those additional perks that FEHB did not offer you. And again, what are you going to get? Probably a give back towards your Part B premium, all right? And so if you're in one of those scenarios, I think those are really, really great options to look at because you have somewhere else that you can go to get your prescription drugs. All right, so there are definitely times when I think an Advantage plan is going to make sense. Again, when you go on Medicare, you have to evaluate all your options. And again, for those particular reasons, especially if your budget's so tight, I find most people are not going to be able to keep their supplemental plan because they just simply can't afford it. So find the very best Advantage plan that you're comfortable with. Now, some people could afford the supplemental plan, but they say, no, I'm all right with networks, and I'm all right with pre-authorizations. I'm all right with the max out of pocket. I can handle that. And so those kinds of risks of even being on the plan permanently do not bother me. And especially if you have VA, TRICARE, or FHB, looks very seriously at that MA-only plan. We find a lot of people in that situation find that Medicare Advantage plan really, really makes sense.